Hi, today I'm going to be talking about psycho-oncology, a very brief basic introduction. This talk is actually part of a larger talk on PBL, problem-based learning, that I'd done with Dr. Renu John in the Department of Biomedical Engineering at IIT Hyderabad. We'd presented this 2-hour lecture to Japanese students who were visiting IIT Hyderabad. So the overview of my talk is going to be providing a very brief introduction to the biomedical aspects of cancer, and then going on to talking about a very brief introduction to what psycho-oncology is. Now, cancer is basically the unrestricted, unregulated, or uncontrolled division of any damaged or abnormal cells. And cancer can be categorized into 5 categories. One is carcinoma, the one that we can see more frequently, where the tumor starts at the skin or the tissue and it covers the internal organs. And then there's sarcoma, which is the origination begins at very specific tissues, so for example the bone. And then leukemia, which is the cancer of the blood or the organs that make blood. Lymphoma and myeloma are cancers that begin at the cells that are part of the immune system. And the CNS ones, which begin either in the brain or the spinal cord, or both. Now, cancer is understood in stages, and there's this technique called the TNM staging that's used to figure out the extent and the degree of damage that the cancer cells have done to the body. So T is the extent of the primary tumor, N is the degree to which the nearby lymph nodes are affected, and then M is the presence of metastasis, which is basically if the tumor has spread to other parts of the body. Now, the stages are also done numerically. So there's stage 0, where the cancer is just in the beginning stages and it has not gone even beyond the layer at which it has actually begun. So this is a very promising stage to be identifying cancer. Then there's stage 1, where it's localized but to only one part of the body. Then there's stage 2, which means it's been locally advanced but it's still in an early stage. And then there's stage 3, which is locally advanced, but the staging will depend on the type of cancer. But usually it's in a slightly later phase than stage 2. And then there's stage 4, which is the cancer that has spread from its primary location to various other parts of the body. So that's where the metastasis occurs. Cancer is treated in a wide variety of ways, but the 3 most commonly used methods are surgery, chemotherapy, and radiation therapy. Then there's also immunotherapy, hormone therapy, and bone marrow transplant, and these are all part of a cancer treatment. Now, cancer treatment has several intents. There's the preventive intent, the curative, and the palliative care. So preventive care, as you may have understood, is trying to prevent the very onset of the disease, either through medicines or most likely lifestyle modifications, which means that perhaps introducing more diet, more roughage, or it could be trying to reduce tobacco consumption, for example. These are lifestyle modifications, lifestyle habits that need to be changed in order to prevent getting cancer. Then the other method is curative. Again, as you have understood, it means finding a cure, knowing that it is achievable. So knowing that you will be able to cure this cancer is called curative care or curative intent. And finally, the palliative care or the palliative intent is basically when you're focusing more on just managing the symptoms of the disease. So for example, pain, nausea, breathlessness, these kind of things, but it has no intent, but the treatment has no intention towards providing a cure. So that means that the cure is not achievable for the disease. Now, just to kind of quickly give you the World Cancer Report's statistics, we have approximately, and these are 2012 statistics, we're yet to see the more recent ones. We have approximately 14 million new cases each year, well, in the year of 2012, and we had 8.2 million deaths due to cancer. We are expecting that the number of new cases to rise by 70% in the next 2 decades itself. Now, among men, the five most common sites of cancer across the world in 2012 are lung, prostate, colorectum, stomach, and liver cancer. And among the women, the five most common sites of cancer are breast, colorectum, lung, cervix, and stomach cancer. Interestingly, more than 60% of the world's total new yearly cases occur in Africa, Asia, and Central and South America. And this accounts for 70% of the world's cancer deaths. So that's pretty stark statistics for us right there. Now, the most common causes of cancer deaths are lung cancer, liver cancer, stomach cancer, and colorectal cancer. And you may see that there might be a link between lifestyle choices and these cancers, but we'll discuss about it in a bit. So, psycho-oncology. So, as you may have figured out, psycho-oncology is a fancy word for the psychology of cancer, or the psychology in cancer. Okay, so we have four main areas in psycho-oncology that we look at. The first is we look at providing psychosocial oncology services for patients and their families. And it is also broadened up or opened up to healthcare staff, including oncologists. The other main area is education and training programs. Again, they've been largely focused on communication skills training and psychotherapy kind of educational and training programs. Then there's also research that addresses psychosocial issues that arise from having cancer. So this research can focus on a variety of topics, right from feasibilities of certain therapies to, what's the nature of pain, so something a little bit more abstract within the domain. And finally, publications of research and scholarly papers, so making sure that our research is being disseminated and consumed. So, by the way, Jimmy Holland is considered to be the mother the person who introduced psycho-oncology to the world, really. Now, the main aspects of psychology of cancer, the first thing that comes to mind is emotions, right? Because there are so many emotions that come into play when we're thinking about cancer. The patient undergoes or feels, what the families feel, and also what an oncologist might feel. So the emotions are something that are a very central feature to psycho-oncology. The other thing that's very central is thought processes. So what kind of thoughts run through the people who have been diagnosed with cancer? What are the decision-making processes that families go through? What are the things that oncologists probably think when they want to disclose information about the prognosis of cancer? Then behavior. So what are the precipitating behaviors that may have caused cancer? What are the behaviors that people engage in, say, after they've been diagnosed with cancer? We're looking at adherence or compliance. We're talking about body language. There's lots of things that go into the behavior that's associated with cancer. And finally, we're looking at mental health. So in a way, emotion, thought processes, behavior, sure, but all of it is contributing to ensuring the mental health of patients. So we've been talking a bit about behaviors. Remember I pointed out the pie chart and I said, well, doesn't it feel like the top 4 cancer deaths are being caused by are cancers that may be related to behavioral risk factors? Well, it's not conclusive, but the World Cancer Report did find that there were 5 leading behavioral and dietary risks that caused 1/3 of the cancer deaths. So it is debatable, that's what I mean, but they have found the correlation, which is with high body mass index, which is basically obesity, low fruit and vegetable intake, which means that not having enough nutrients / roughage, the lack of physical activity, tobacco use, and alcohol use. The other things that have been related to behavioral risk factors of getting cancer are being overexposed to the sun, chemical exposure, and having poor screening attendance, It could be breast self-examinations, genetic counseling, or just coming in for regular cancer screenings after a certain age. So just like there are stages of cancer, there's also stages of psychological focus in cancer. The first being the diagnosis, at the phase of diagnosis. There are questions like genetic counseling, is it required? Breaking bad news, timing and waiting for the results to certify or to make sure that this person has cancer. Seeking out help once one discovers that they have cancer. What's the kind of decision making that they will take around the treatment of cancer. So there are so many things that go into once a person is diagnosed, or even before when one is seeking a diagnosis. There are so many psychological experiences or psychological phases that they may be going through that psycho-oncology can contribute at. And then there's, of course, the treatment phase. So what's the hospital admission experience like, and how does that, feed into their psychological well-being? What is the fear of the treatments or the treatment side effect? The fear of surgery, for example. So body image issues. What's the effect of having chemotherapy, for example? So what are the psychological reactions to now going through the process of cancer? How are they adapting to the disease? And then comes the evaluation. So now this person has tried to seek diagnosis, and then they're diagnosed with cancer, then they receive the treatment of cancer, and now they're evaluating the effectiveness of the treatment. Again, there are so many emotions that a patient would experience, right? There's fear, there's anxiety, there's, again, decision making. If the evaluation is poor, if the evaluation is positive, then what is the kind of decision making they're going to do? What's a behavioral response to something like, a positive or a negative evaluation? But then there's also the bereavement, or especially when patients are faced with a poor prognosis, the facing of their own death, grief and loss, grief over losing their relationships due to death, or the grief of just losing their own life. This is again a stage that's rife with emotional distress, psychological distress. And again, this is a phase where psycho-oncologists can provide a lot of support. And finally, there's also survival. I've had a lot of people say, hey, why would survival pose any kind of psychological issues? Shouldn't the patient be happy and really, really ecstatic that they beat cancer? But no. Patients are very pleased. Of course, it's a very pleasing experience. Of course, it's ecstatic. But also, some patients experience fear of recurrence. They may experience, they'd have residual emotions from having gone through the process of cancer, the harrowing experience of having cancer. As I said, the fear that they might get the cancer again, fear that their children might get cancer, that they might be passing it on to their family members. And also, surviving cancer in itself is a very, very trying experience. Some of them might not even be prepared to have survived cancer. So then what happens when they have to recalibrate their life? So surviving of cancer is now becoming increasingly a studied upon topic, but also about how can we harness the positive experiences of surviving cancer for the sake of patients who are undergoing cancer treatment or seeking diagnosis or just received diagnosis. So how can we harness the positive emotions that cancer survivors might experience and use them as volunteers to provide support for the other patients? So we were just talking about the stages at which we would provide some focus, right? So then the question is really, what are the psychological effects of having cancer on the patient? So there's depression that a lot of patients experience. There's anxiety, psychological distress, body image issues, suicidal ideation, and impaired cognitive functioning. I wonder if you've ever heard the word chemo brain. That's something that was studied upon and is continued to be studied upon quite a bit. It's basically the effects of having chemotherapy. It kind of, there's research that shows that there's slight impaired cognitive functioning and difficulty in recall. Now, it could be because of chemotherapy, but it could also be that the person is very distressed by the chemotherapy cancer and therefore is unable to recall information that easily. Suicidal ideation, a lot of patients experience this because they may wonder about what's the point of life, what's the point of going through all this physical trauma, and that could cause a lot of distress. Now, the children and parents of cancer patients is also something that there's been a lot of research that's looked into it in the field of psycho-oncology. Of course, the stress is immense among parents of children with cancer. That there's been research that shows that parents have higher rates of post-traumatic stress disorder than either their children or adult cancer survivors experience. So this basically suggests that parenting a child with cancer can be even more traumatic than actually having the cancer as an adult by yourself. And the other thing is that children of cancer patients also feel extremely vulnerable. They also experience many psychological issues. They experience acting out behaviors, and they have problems in school and integrating into their social environment. Now, the other side of the coin, is the families. Just as patients experience a lot of psychological distress due to cancer, so do family members. They experience anxiety, depression, distress, the fear of recurrence in their in the patient, and fear of the fact that they may also get cancer if they're the child of the cancer patient. So there are all these worries that that family members go through because they're primary. A lot of them are primary caregivers, right? But there's a concept called caregiver burden that exists in the field of psycho-oncology. Now, what they look at over here is looking at the burden of caregiving, because it's not an easy job to be able to take care of somebody who's also going through such a harrowing, painful experience. It is, it has a fair amount of domino effect, and because it's also such an intense experience. So caregivers have reported increased risk of an illness, high levels of psychological distress, a disruption to their professional and personal roles, costs in terms of their time and the loss of work productivity, and more increased mortality, basically. So the impact of cancer is immense, not just on patients, but also on families. But it's not a coin, it's a triangle. So oncologists also experience the burden of cancer. Although unfortunately, research has mostly focused on improving oncologist skills, and so have looked more at what can oncologists give to patients and their families in the form of educational or emotional support. How do we optimize their communication skills? How do we help them identify distress, depression, or anxiety in patients? How do they provide proper referrals, and so on? However, there's some research that has looked at the impact of cancer on oncologists also. So, for example, there's been research that has looked into the emotional stress and distress that cancer causes to oncologists. But oncologists have said that they know how to, or they find a way to manage their emotions and just steel themselves. There's been a lot of research that also has looked into burnout, that is the frustration or the sense of failure or emotional physical exhaustion that comes with being an oncologist. But again, a lot of the oncologists have reported that they mostly feel satisfied with their jobs. So one can also empathize with where oncologists are coming from, because they too experience, as we can see, a lot of the impact, the negative impact of cancer, but they do report having an overall positive attitude towards their job and their patients. So with this, we are coming to talking about psycho-oncological interventions. Sorry about that weird pause at that between the two slides. I have no idea why I did that. But anyway, getting back on track, there have been several types of psycho-oncology in oncological interventions that have been researched upon, and the ones that are the most popular are the ones that you see on your screen right now: psychoeducation, cognitive behavioral technique, mostly to deal with anticipatory nausea, vomiting, pain, emotional distress, and fatigue that comes from cancer treatment. The problem solving discussion, mindfulness based therapy. Now, this is something that's become fairly hot, and there's been a lot of research that's looking into it. Group therapy, joint family interviews. Now, this is another interesting one because there's been research that looks into how do we include the family and the patient within the therapy group and provide this kind of more family oriented intervention. Then there's been research that looks into the feasibility of telephone and internet based interventions, especially for people who have no access to this kind of one-on-one services, counseling services. And finally, there's been immense research that looks into communication skills training. A lot of it focuses at the oncologist. So how does the oncologist improve their communication style? But increasingly, or more recently, there's been research that looks into communication skills training for families and also for patients. So it started off at looking at patient prompts, but it's also now looking at being more family inclusive and ensuring communication within family members and also with the patient, obviously. So with this, I end my presentation. Thank you for listening through this one too. And if you have any questions, comments, and feedback, please do drop me an email. I'm more than happy to answer it and listen to your comments. Also, feel free to drop a comment in the comment box of this YouTube video. Okay, well, until next week, bye.